So today is the last webinar in our Working Towards Dementia Friendly Communities webinar series. If you've been with us on our others, our first two included videos from individuals living with cognitive impairments and their partners. And those videos were examples of the lived experience of living with cognitive impairment and some of the things that they went through. As we've mentioned several times, that is just the experience of those 6 care dyads, but we hope that it impresses on you the importance of having conversations with those individuals in your communities, especially as we talk about our topic for today. And although I can't credit this quote because I'm not sure where it came from, we believe strongly in nothing for them without them, and the importance of representation in conversations rather than us just deciding what individuals need and what we think will be best for them. And so throughout today, as we discuss what communities can do, please keep in the forefront of your mind, including individuals that are living with dementia and their care partners in these conversations. So we had those first two sessions, as I mentioned, about lived experience. Last week, we had a Dementia Friends information session and made some additional dementia friends. And then today, we're going to kind of take all of that and transition into a community-wide approach of dementia-friendly communities. So what is a dementia-friendly community? A dementia-friendly community fosters the ability of people living with dementia to remain in their community and engage and thrive in day-to-day living. It's informed, safe, and respectful of individuals living with dementia, their families, caregivers, and provides supportive options that foster quality of life. So that's easy, right? 5-minute webinar, we're done. You can have the rest of your day back. Everyone knows how to go out and do that, right? Probably not. It sounds good on paper, but when you start getting into how do I actually do that, it might seem a bit more overwhelming. And so the purpose of today is to share with you resources from Dementia Friendly America that outline a nice little roadmap of steps that you can take in your community to work towards dementia friendly communities. Now in Georgia, we've been very careful about how we talk about dementia-friendly communities. It differs. Other folks will say, you know, my town is now a dementia-friendly community. We've hesitated to do that here because we are concerned that once you do that, then you sort of put a plan on a shelf, never look at it again, and things sort of go back to the way they were. We like to say that we are always working towards being dementia friendly because it is an ongoing process. There is always work to be done, and we want to be sure that as communities are always making decisions and doing new projects, that this population is always considered in those processes. So that's why I won't talk about, you know, here's a few steps that you take and then you're done and you can put a seal on things and say that we are always working towards it. But that is not always the case, and so you will see terminology in some of these resources about being dementia friendly. And so just keep that in mind, whether you call your community that or not, that this should be an ongoing process that you should always be continually working towards. So before we get started, we're going to watch a little video about dementia friendly communities, and then we'll start talking a little bit more about those resources.
As members of a community, it can be easy sometimes for us to spot someone in need. But when it comes to people with dementia, the signs are not always so obvious. Without the support of the community, families and individuals affected by dementia can often feel invisible, lost, and in some cases, in danger. Everyone has a role in creating a safe and supportive dementia-friendly community. Your community can take steps to become dementia-friendly by following a 4-phase process. In Action Phase 1, you'll bring people together from all areas of the community, from government to healthcare, local businesses, and faith groups. Everyone from young to old should be invited, especially people living with dementia and their family and friend care partners. In Action Phase 2, your community will assess your current strengths and gaps when it comes to meeting the needs of people living with dementia. Then you'll share information with community members so they understand and have resources for adopting practices and policies that will make it easier for people with dementia to carry out their everyday activities like banking and shopping. In Action Phase 3, you'll prioritize what your community can do to become more dementia-friendly. Finally, in Action Phase 4, your community will act together, taking steps to become dementia-friendly and improving the quality of life for everyone touched by the disease. Ideally, all areas of the community adopt dementia-friendly practices, and the entire community undertakes goals they have chosen together. You can become part of a growing movement in creating dementia-friendly communities. By taking small steps together, we can make a real difference.
Okay, so we're going to jump into this community toolkit and kind of walk through each of these phases. I do want to let you know the toolkit is available online at the Dementia Friendly America website. It is not all in kind of one place. It's through a variety of different pages on their website. And one of the things that we have done in this project is combine all of that into a hard copy workbook that walks you through those different phases and then has links to the additional tools and resources that we'll discuss. If anybody would like me to mail them a hard copy or copies of this guide, we will happily do so. So you can send me a private message through the chat with how many you'd like to request and where to mail those. And we will do that until we run out of them. So please keep that in mind as we go throughout. I do want to, at this point, just remind everyone, in case this is your first webinar with us, that this webinar series, as well as the videos that we've been showcasing, were made possible due to funding from the Georgia Department of Human Services. So we are grateful for that funding to be able to share this information with you today, as well as share that hard copy version if you choose. So a brief overview of these phases. Phase 1, as mentioned in the video, is convene. So this is where we'll convene our community leaders and members, help understand what dementia is in the community and its implications for the community, and form our action team. We will then engage key leaders to assess strengths and gaps in our community using an engagement tool. Analyze is step 3, where we will analyze the community's need and determine what issues stakeholders are motivated to act on, then set community goals. And lastly, we will act together to establish implementation plans for your goals and identify ways to measure progress. So for those of you who have started sending me messages, if you could please send me the address as well, just so that I will know where you would like me to send those, that would be great. So let's dive a little bit deeper. And again, I'm not going to go through all the ins and outs of these phases. Today is more about just letting you know that this resource is available and talk you a little bit through the process. But please know that all of these steps have a lot more information and a lot of resources so that you don't have to reinvent the wheel. However, I do want to point out at the beginning, as we start delving into the phases, that what this looks like for your community will be different than what it looks like for another community, because the people in your community are different. And so there is no one size fits all solution on the road to dementia friendly, but there is sort of this roadmap that walks you through the process. This becomes more clear in sort of the goals that you decide to enact and work towards. So the process may be similar, but what you actually end up doing will vary depending on your community. So in phase 1, one of the most important things to get this started is enlisting a champion. If you've ever tried to enact change in a group or in a community, you know the importance of having at least one, preferably a couple people who are very passionate about the project and are willing to get things up and running and keep it moving forward. If you don't have somebody to sort of keep the ball rolling, a lot of times things will sort of die out. And so, and part of determining if your community is ready to undergo a process like this, you have to determine who are going to be those key people. Now, that might be you on the call. It might be someone that you know. Maybe your role in this process is to take what you've learned today and share it with somebody who you think has the time and passion to take this project and run with it. Perhaps as we go through this, you recognize that your community as a whole may not be ready, or that you may not be willing to undertake that as a whole, but you can still enact some of these same items within your organization. And we won't have time to get into it today, but on the Dementia Friendly America website, there are also sector-based resources. So depending on what sector your organization is in, such as healthcare or banking or a restaurant or whatever, there's sector-based information so that you can look at your own organization within that. So this can be done on a smaller scale as well as a larger scale. But back to kind of looking at a community as a whole. First, we enlist our champions, and then we talk to the champions to discuss readiness and building an action team. The action team is not going to be extremely large. This is going to be that core group of people that are going to sort of like an advisory council almost. And so you're going to start recruiting that action team of people who can get things done and who are well placed in that community. There's a team meeting discussion guide, as well as a dementia friendly community overview PowerPoint that is very similar to this one. This one was a bit more Georgia based because we added some other things, but just sort of going through those different phases, as well as some various metrics that you can utilize in kind of getting that conversation going. Then you're going to build your case. And this is kind of why is this needed in our community? This is where you may look up statistics from your community about how many people are being served or across the state and what that looks like. Your area agency on aging may be able to help you with some of this information if you don't have it. You can also look, and I'll be sharing the Division of Aging Services website later. They have some dementia resources that might be helpful in when you look at the Georgia Alzheimer's related Georgia Alzheimer's and related diseases, or related dementia. I mess that up every time, and those of you who've been on several webinars know I do. We're so used to calling it GARD, but we're very bad about acronyms in the aging world. But regardless, what I'm trying to say is in that plan, there's some information about why it's important for Georgia to be looking at that, and that might be able to be tailored down to your community when you're making this case to other folks. The Dementia Friendly America website also has some items that might be helpful more on a global scale if you aren't able to find what you need locally. And on the right of these slides, you'll see some of the examples of resources that might be helpful. So again, you're not having to recreate an invitation letter, or recreate a budget template, or so forth. Let's move on to phase 2, which is engage. So after we've made our case and we've gotten our action team together, and we've sort of kind of gotten that team together, and maybe we've already set some timelines or a list of other people we want to bring in. Some people even do a kickoff event as part of phase 1, and I know that is less likely during COVID times, but it's still something to consider. Then we move more into the engage portion. And engage is where we are engaging those key leaders to really look at the strengths and gaps in our community. So what are we doing well, and where could we improve? So we form a community engagement team. And with that community engagement team, that's going to be who drives the assessment effort. That can include people from the action team as well as a broader group of folks. These are folks that are going to be connected in the community and able to get out there and really help us assess what's going on. It's important to clarify what the functions of individuals are, as well as what are the aims of this engagement, so everybody's on the same page. And again, there's resources available to help figure out what those key pieces are going to be. The next important point is to develop the community assessment. So again, the community assessment is going to be how we figure out what's going well and what's not going so well within our communities. Every community has different needs and capacities for conducting an assessment and different time and resources. So it's important to identify what is feasible for you to be able to do, whether that's a survey, whether it's focus groups, whether that's, how many different segments of the community do you want to get input from? What's your timeline? Do you have volunteers to help with it? Do you have, the ability to use interns or other groups to assist with getting the word out? Do you have avenues to get the folks that you want to do? So this could take some time to kind of outline this process and make sure that you do it well, because you don't want to keep having to go back to the community over and over and over again. They're going to lose interest. You really want to spend enough time planning this out on the front end so that you can roll this out in a good way and see what's going to work within the scope of your group and what they can accomplish. On the Dementia Friends America website, there are sector-specific questionnaires that you can utilize. So if you wanted to interview folks from the financial institutions, there are specific questions around dementia-friendly capacity for that group. There's different ones for more service industry. There's different ones for healthcare and so forth. Or you may choose to just take questions from all of those and do one survey for everyone. It really, again, depends on what your resources, what your time frame, how many people are willing to help with that. But there's a lot of information to pull from so that you're not having to create these questions yourself. You can really utilize what's already been out there and been used in communities across the country. And then after you've spent time developing the community assessment, you will then conduct the community assessment. So based on the scope and the method that you determined, you're going to train the people that are going to be conducting it so that everyone's doing it the same way. Assemble whatever resources are needed so that folks know what they're doing. If they're going to be conducting interviews, make sure that everybody's doing that, in a similar way and knows how to address questions that might come up. If it's a survey, make sure that, you have the resources for people that are sending that out, and how that's going to be sent back and so forth. It's important to develop a very organized process and timeline. If you're sending out a survey, how long do people have to complete it? How many reminders are you going to send? What tool are you going to use to collect that information so that it's analyzed for you? There's a lot of survey tools available. Those have different costs associated with them. It's likely worth it to do something of that nature where it's going to do the analysis for you in a way that's really easy to utilize, so you don't spend a lot of time on your own having to analyze each one specifically. And if you're doing focus groups, there's a lot of additional information with regards to that to schedule those, especially now where they would likely be Zoom focus groups, and get that set up. And one other note that's in the toolkit that I just think is very helpful is providing the thank yous to the people that participate, especially if it's a more engaging process like an interview or a focus group, making sure that you tell folks that you appreciate their feedback. And as I mentioned at the beginning, it's extremely important that no matter who you decide to reach out to in this process, that individuals living with dementia and their care partners are on that list. It's very difficult for a community to decide what they're doing well and where they need work with regards to dementia if they don't actually speak to individuals living with dementia. And so part of the planning process will be engaging organizations that serve these individuals or other methods of actually reaching out to them so that you can get that feedback. People often assume that individuals living with dementia don't have the capacity to provide that feedback. And that is simply not the case. For those of you who've watched our videos of our 6 care dyads, you saw that they were able to provide a lot of feedback. And we're going to hear from them again later in this webinar to hear of things that they would like their communities to work on. So do not assume that people aren't able to provide you with that feedback. Make sure that you're reaching out and encouraging them to provide it, because that's where you're really going to get a really good idea of where things may be lacking. You may think a community is doing something super well because the professionals all think it's what it is, but the messaging could be off or the delivery could be off, and it might not be landing with the people that you're trying to serve. The next phase is analyze. So this is going to be an extremely important phase after you've done all of that work to get people engaged, where you've gotten feedback from all the different sectors of your community. This is where you're going to look at what everybody's been saying and compile that into a report that identifies patterns and strengths, gaps, and opportunities for action. It's important to share this information in some way with the community. We're going to do a little bit more of that in phase 4, where we call for action, but you want to make sure that you are keeping the folks that have been involved engaged and let them know where you are in the process. The planning for these different phases can take some time. So if you did a kickoff event in phase 1 and then no one hears anything from you for months on end, you're going to lose all that excitement. You want to keep people engaged throughout the process and let them know how things are going. There's a lot of wonderful resources to help you figure out how to identify these strengths and gaps and opportunities for action and put those in great tools that will assist you in selecting your priority goals. So based on the data, your group are going to select which goals you think the community should consider undertaking. What are the things that came up consistently? Perhaps there's some low-hanging fruit that you think would be a good thing to go after to continue getting people excited. So you may have some short-term goals and then some that are going to take longer. But successes early on can be very important in keeping people engaged, especially your community leaders. Elected officials, for example, things that they can kind of put their name behind and showcase in the media and so forth can be a good thing to keep them on your side. If something's going to take years down the line, that might not be a great thing to start with, although you could still put in some of that legwork. But keep that in mind as well, is that you want kind of a range of items, both short-term and long-term. You're going to draw conclusions and kind of rank these things based on, again, what's going to require high levels, what's going to require low levels, what came up a lot, as well as things that are realistic for your community. So maybe there are items that are beyond the scope of your community. Perhaps they require statewide legislation, for example. That doesn't mean that your community can't work on those, but it's important to kind of identify what is within your realm to develop and what you might have to advocate for outside of the boundaries of your community. You're going to summarize these things into some kind of report that will be easy for folks when we move into phase 4, which is act. And again, continue to follow up with folks to thank them and let them know the progress that you're making. So in phase 4, this is where we're going to act on the information that we just learned when we analyzed our results. You're going to share the results and involve the community. So this can include planning and facilitating either a formal or informal community-wide meeting to report the results of the assessment process and brainstorm possible activities that could be accomplished in each of the priority goal areas. You're going to create and implement a community action plan. So this action plan prioritizes opportunities and community priority goals. This will help you in determining if you need to seek funding to support different aspects of the work, act together to execute the plan and achieve a shared vision for working towards becoming dementia friendly, and continually evaluate and celebrate your progress. And remember to assess new opportunities along the way to keep the community informed. So although you may accomplish some of the goals initially, we mentioned before that this is an ongoing process that you want to continually look at. This is also a stage where you may end up engaging new members who were not involved in the previous 3 phases, depending on what your goals are. And I'll just think of an example. Perhaps one of the items mentioned was we would like a dementia-friendly night at a restaurant where things aren't so busy, maybe it's not as bright, things of that nature. But if you didn't have anybody from any local restaurants in your group already, that goal is going to be difficult to accomplish. So based on that goal, then you would then recruit individuals from local restaurants to do that. So part of this, again, is going to be based on our goals, who do we need to engage to start moving toward that? Or maybe it's somebody that has a specific skill that you need. If it's a marketing, public awareness campaign that's needed, you may need to pull people in that have that skill set. So keep that in mind as you're looking in terms of who else you might need. So these are some examples of community actions that have come from other communities across the country. And again, this doesn't mean that these would be what your community does, because you don't know what your strengths and weaknesses are yet. You don't know what those individuals living with dementia have identified as important, but this is just to, again, give you some examples of things that have come out of this process for others. Offering training to faith communities. And I will do a slight plug. We're getting ready to start our GGS Fall webinar series, and one of those webinars, which will be on November 11th, and was sent out to our network today. So if you don't have that email and you want the information, you can send me an email and ask for it. But it's about an ALTER program, which is a dementia-friendly initiative for faith communities. And there are other trainings, so that's something that is important to your community. There's resources out there for that. Collaborating with law enforcement on training, identification bracelets, file of life initiatives. In Georgia, we have something that's called the Yellow Dot program. And when I give you information about GUARD and some of the Georgia things that are happening there, you could get connected on more information about that if that's something that your community thinks is important. Working with local hospitals and physicians to promote early diagnosis and connection to community resources. In some of our webinars earlier in this series, we talked about diagnosis. We talked about some community resources and other things to assist with that and tools for that. So that may be an area of education and need in your community. Identifying partners for hosting memory cafes. Memory cafes are really wonderful tool to provide services and not really service, but opportunities for individuals living with dementia to have a safe place to connect with others, to really help with isolation and just sort of a fun and engaging experience. This is different from, say, like an adult day health or something like that. It's a different experience. And there's a lot of information out there about memory cafes. We do have some in Georgia. But that's something that you consider. And there's virtual dementia cafes happening now in times of COVID. So maybe that's a need for your area. Developing dementia-friendly business initiatives. There's a lot of really good information on the Dementia Friendly America website about business initiatives, what that would look like. One thing that's really important there is not a one and done. So a business can't go to a training once, call themselves Dementia Friendly, get a sticker, and then that's it. Because there's turnover and new people come. And so if your community wants to undergo something like that, it's important to think about how do we make sure that we don't cause further harm by having businesses identify as dementia friendly, where individuals would then think it was safe and then go and have a bad experience. So how do we ensure that there's continuing education, that a certain percentage of staff must be trained at all times, that there must be yearly retraining or whatever it might be, to really make sure that there's buy-in from those communities and not something that's so simple that everyone does it and it's not meaningful for those folks. Or as you know, the example I mentioned earlier, working with local restaurants for dementia-friendly dinners. So now I want to show a video of our care dyads where they will discuss what's helpful for them and their communities. Now again, this is not something where these particular items will definitely be what your community needs, because they may not live in your community. But I again want to just provide other examples and feedback and share again the importance of hearing it from their mouth of what is important to them, just to kind of help you think through what are some types of things that could come out of this process in your community. And again, if the sound, we had some issues last week with sound, so if the sound is not good with this video, please let me know.
If we just go to a restaurant and don't make reservations, but she'll say, tell them that he has, a lot of times she'll say, he has a rare form of dementia. Can we have a table in the back against the wall out of the mainstay? And but you know, and then when she does, if we're going somewhere a little more fancy and we need reservations, she explains them when she makes the reservations, so that I'm away from the noise of all the conversations going on.
If restaurants had a place where you would come in and say, there's dementia in our group, and they had a place for that was quiet and away from children and away from noise and things like that, that would be very helpful. Or have something in their window that says, we're dementia friendly, that we know that they have some education in dementia and will be able to handle it if someone comes in and starts asking questions that don't make sense or ask the same question over and over. And if communities would educate themselves about dementia and how they can just treat people like they're people. And if they don't understand, there's usually somebody with them. So if they just understood that they're still people and they still want to go out to eat and they still want to go to the movies and they still want to do things that everyone else does. And it becomes uncomfortable sometimes when the establishment does not understand what's happening. And so if communities were more aware of what dementia means and that there are different dementias and people can be very young. Frontotemporal dementia can come on as early as your 20s, and no one expects someone in their 20s or 30s with small children to have dementia. But that's what happens.
Where people will look at me and they'll see that I'm having a difficult time, and they'll just step over where I am and take my plate of food or whatever it may be, or whatever situation I find myself in. And it's amazing what people will do and can do a lot of times. You know, for those that do have some handicap.
Or how would you want to be treated by the clerk?
To know enough about what she was seeing, that she could say, is there something I can do to help you, or something like that.
I do feel bad. You know, I grieve for Steve because he was such a social animal in Savannah, and it has been hard We visited one particular church and examined a lot of their groups, but there just doesn't seem, and maybe we haven't tried hard enough, but there just doesn't seem to be a social group for Steve's particular place in his life, and one that he would seek to be a part of. As a caregiver, as a person who works full time, and also as a caregiver, that it is truly, I mean, it's truly a second job, and it's truly sometimes it's a struggle, and that I've looked at support groups, attending support groups, but a lot of the support groups are actually in the mornings and during the day when I'm working, and then a lot of times at night I'm just once I get it all done, I'm just too tired to go.
This is a nice place to come. Everybody's friendly and everybody is supportive, and so that kind of environment is helpful to the patient, me, because, I feel more comfortable. I feel more relaxed. I'm not trying to focus on what I'm saying or what I shouldn't say or whatever. I'm just going to be myself. And that's exactly what I do. And that seems to work out fine. So I think that even though at some point in time we have discussions about what we need to do for ourselves in the way of medications, or in the way of treatment or whatever, then that's another issue. But for the most part, this is an interactive environment that supports mental health in the way of engagement, and in allowing the patient to open up and express himself or herself, and also have some interaction that is meaningful, which is something that we all need. There should be a clearly public information that there is help available right here where you are. And that you could be referred, or you could be seen, or you could have someone come and see you and have a discussion with how you can be helped. And I think that would go a long ways toward giving the community a lot better support.
Making the community more aware that you have people out there with this disease, and kind of like an awakening to get the community to start thinking, okay, what can we do to help this situation?
On a really serious side, short of wearing a sign or having a badge on that says, I have dementia, watch out for me, he's made his safe world, but a lot of people haven't. And if they go into a setting and all of a sudden they're acting differently, people don't know how to handle that. I mean, who knows? What if they call the police or somebody? I mean, the whole entire community needs to be educated on different scenarios. I just think every professional that works in the community going out to people's homes need to be aware somehow that person has dementia.
So they made sure that we were able to go into the health room whenever he needed to go to the restroom, rather than having to either chance me in the men's room or him in the ladies' room and someone else coming in. So they made it very easy for us to be able to do the things that he needs to do normally, but in a safer environment. It's not something dealing with old age per se. You can be 30, 35, 20, and still see these signs and try to get the help you need. I would ask them to find out more about the different types of dementia. I, as an advocate for FTD, and he was diagnosed with the behavior variant. As an advocate, I do carry pamphlets with me all the time because you never know when something can occur. So I always try to find a way to educate someone if he does something differently, and I found that it helps. So anytime you see someone doing something that maybe doesn't look normal to you, don't feel as if you can't go and ask maybe that caregiver or that partner that's there if everything is okay or if there's anything you can do, because you may learn something about that person or why they're doing that that may be helpful in your own home or in your own community.
I just think education is the key. And obviously the GGS is doing that, the Alzheimer's Association, Rosalind Carter, obviously Emory, at least locally. And I think that's just the key is, it's fairly new, and it was kind of shunned, or the persons with Alzheimer's were kind of shunned, and they were just kind of ignored, or people didn't know how to deal with them. But I think, again, education, that, these are regular people. This is what we can expect. And
Turn the light back on so that y'all can see me a little bit better. All right, so again, I just want to thank the participants in our videos. If you've been joining us on others, you saw a variety of videos from our care dads, and we really appreciate them taking the time out to share their lived experience with us, and they were very hopeful that what they had to say would be helpful to others. We want to thank the Georgia Department of Human Services for the funding they provided for this project, and also the GUARD Collaborative for allowing us to put their stamp of approval on these and continue to utilize these in other aspects of their work. Before I begin discussing additional resources, I did want to take a minute to talk about dementia-friendly communities from the standpoint of COVID-19. You may be watching this going, this isn't the right time to start a big initiative because people have other things on their mind, or we can't meet in person. And that's completely understandable. Perhaps for you, the time is just to educate yourself on these steps and get to a point of readiness so that when things hopefully get back to whatever our new normal looks like, you're ready to engage your community. However, I would caution you not to think about this as something that waits until after COVID. It might in terms of those formalized kind of steps, but this population has been hit extremely hard by COVID. If you imagine the difficulties that each and every one of us have faced, that older adults have faced, imagine adding on to that the complications involved with dementia, the confusion of trying to understand what's going on for those that are living in assisted living or nursing homes, the confusion of why family members and loved ones and friends haven't been able to visit, why everybody is wearing a mask, why people are wearing PPE if they're further along in their diagnosis and don't understand what's going on. You can imagine that this is a particular population that's been vulnerable, and this has been very difficult for. And so as you in your organization or community continue to figure out how to live life around COVID-19, do not forget this population. Even if it's not a formalized dementia-friendly community process, make sure that you are talking to these individuals about how they're being impacted from COVID-19 and how whatever solutions you're considering and other things you're considering will impact them. So that's a slight little soapbox there around that, but I just think it's very important not to look at what we've discussed over this past month as something that waits until after the crisis is averted, because they are in crisis as well. So moving forward, again, I just wanted to put up the email for Dementia Friendly America. Everything that we've talked about today is available there. You can continue to peruse that or request hard copies from me. All those resources that were on the right side, like the questionnaires and all of that, are not printed out, because then it would be like binders of materials. It's really going to depend on what it is you need. But we do list those out. We have the link of where you can find those so that you can get what you need for that process. And whether you do it now in the chat or decide that you want it later, just let me know how many you would like and your address, and we can send that information out to you. I also wanted to share the email for dementia resources from the Division of Aging Services. These are some headliners of various categories of information on their website. Each of these, if you click on the arrow, have several things under that. You can learn more about the Georgia Alzheimer's related dementia plan, publications and products, additional dementia resources for Georgia, as well as some more federal ones. And there's a lot of really good information there. It's a good place to start learning more. I am going to ask Aline, she didn't know about this, so I'm putting you on the spot. If you will please share your email in the chat, because for those of you who were on the information session last week or have attended one before, if you were interested in becoming a Dementia Friends champion, Aline Stone with the Division of Aging Services is the contact for that. And I do believe that there is a champions training coming up soon, if I'm not mistaken. And for those of you who listen to this recording later, it's aline.stone@dhs.ga.gov. She also heads up the GUARD collaborative. And so if you're interested in learning more about that and want to be on one of those work groups and be more involved in that work, she is who you would contact to get more engaged there as well. I also wanted to share the GGS Dementia Friendly website. This is where you're going to find recordings of the webinars from this series, except for the Dementia Friends information session. That is a licensed program that you have to attend live, so we did not record that and it will not be posted. But the other three, including today's, well, the first two are on the website now, and then this one will be soon, as well as the various care dyad videos that you've seen throughout this series, so that you can utilize those in your education and training purposes. And we do ask that those just be utilized for education and training. Please don't use those for any sort of marketing tool or any paid promotion or anything of that nature. It's really to just educate folks formally or informally. If you want to share that with caregivers or other folks that might find those useful, please feel free to do so. And all of those are both on our website as well as our YouTube channel. And there's also information about 2 series of dementia-friendly community grants that GGS has provided through funding from the Department of Human Services. The first one we completed. I'll share what the organizations were that underwent that first one, and then the report that shares sort of what they did and what their challenges were is available on the website. So the first round was from September 2018 through September 2019, and that was the Alzheimer's Outreach Center out of Albany, Georgia, Orchard Senior Living in Brookhaven, Georgia, DeKalb County Human Services for DeKalb County, Hospice of Northeast Georgia Medical Center for Gainesville, Georgia, and the Northwest Georgia Regional Commission for Rome, Georgia. And so you can read more about what they did and sort of how they went through sort of this toolkit. And then our second round, which began in November of 2019 and has been extended through 2021 because of COVID. And so there's not a final report for that yet, but we will share it there at the completion of their grant. The communities that are working on that right now are Caring Together in Hope / Amy's Place in Roswell, Georgia, Cobb Senior Services, Legacy Link for Georgia Mountains Region, Three Rivers Regional Commission, AAA, for Heard County, and the Valdosta State University Alzheimer's Daycare Program for Valdosta. So those communities are currently undergoing pieces of these 4 phases. They're in different places with that. And so if you are interested in being connected to the program leaders for either the first round or the ongoing round, if you live in those areas and you want to get connected with the work that's continuing there, please reach out to me and let me know. I can connect you to those folks, and you can learn more about how to get involved. I did see a couple comments. I just want to see if there were any questions that I need to address. Is the state or GGS planning any type of public service announcement during this pandemic about being dementia friendly? Just seems like we should remind others. Aline, if you want to talk about anything from the state side, I know that there was some more, not necessarily dementia friendly, but dementia awareness campaign being planned from some funding from a previous legislative session. I'm not sure where we are with that. I will say GGS doesn't have anything specific on a large scale. What we've done has been more along the lines of this series in terms of the development of those videos and trying to advertise those out to folks and conduct these webinars that will then be on the website for people to use. If you have avenues of ways that you would like for us to get more information now, I'm happy to talk to you about that, but we don't have necessarily like a statewide plan on the GGS side. That's a bit outside of our capacity at the moment, but I would be happy to talk about that further and see what we might could do there. And I see Aline has also posted in the chat the Eventbrite for the Dementia Friends Champions Training, which is November 12th, if people are interested in that. I will say many of our communities that are looking toward becoming dementia friendly utilize the Dementia Friends program to assist them in engaging their community. I know that sometimes hearing those two names can be confusing. So again, Dementia Friends is more of an individual call for action. And so it's about people kind of learning about the 5 key messages and determining an action step that they can take as an individual to improve the lives of those living with dementia. Whereas the Dementia Friendly is more of a community-wide. And again, I'll mention that maybe your community, like your town, you may not have the capacity to look at this from that standpoint, but you can still utilize these resources perhaps within your own organization and then do something there in terms of assessing within like your customers or other folks are looking at if there's tools that might assist you in engaging things there. So even if you can't take these resources at that higher level because you maybe you don't have the capacity or you can't find additional champions or there isn't as much interest, you can still utilize these in your smaller group. Maybe your church looks at some of those resources, for example. So Aline said, we don't have anything COVID specific. One of the GARD public safety work group goals is to ensure that emergency preparedness plans include information to ensure the safety and inclusion of those living with dementia. So thank you for sharing that, Aline. And again, I would encourage all of you, if this is an area of interest and you have not been involved with GARD, there are a number of different work groups with GARD working on different areas. Aline mentioned public safety. I know there's workforce development. There's a number of them. I won't try to list them out because I'll mess that up. But there are definitely areas that could use volunteers and folks that are interested. And so please feel free to reach out to Aline if you want to get more involved in that process and utilize that as well. Does anyone else have any other questions before we wrap up? There is a question. At one point, there was a dementia-friendly strategy group that was meeting for people that were interested in this. And there's a question about if that group is still meeting. I am no longer kind of, at one point I was in more of a leadership role within that group and I no longer am. So I'm not exactly sure where we stand with that. Again, Aline, sorry to put you on the spot. I know with so much happening at a statewide level with CARES Act funding and so many things coming through, that it's just been kind of crisis after crisis of trying to get things going. But I'm sure that we can try to pull something out to get that going again. And if you want to be added to that listserv, let me know. I can share that with the powers that be. Again, these were just groups that were sort of meeting to discuss what other communities were doing and sort of look at those things. So Aline, I don't know if you have any information you want to share about what's going on with that group to your knowledge. See, she says, we are still open to having those meetings. I know that the GUARD Outreach and Partnership Work Group looks forward to helping carry out some of the dementia-friendly efforts. And please email if you're interested. So yeah, I will encourage you to email Aline if you're interested in those. And that was just a way for communities to sort of brainstorm with each other. And GGS is happy to help get communities to share information with one another from the ones that we know about through our community grants. So if you want to be connected with any of them, we're happy to do that as well. As we close up on our hour, I encourage you to delve a little deeper into some of these resources. If this is an area of interest, there's a lot of work that's already been done to develop tools and resources so you don't have to reinvent the wheel. It can be a daunting process, but it's really about how important this is to you and your community. It's not something you can do by yourself, and your community may not be in a place of readiness, and maybe what you're doing at this point is just to share information with them and try to get them there. Whatever your role is, know that it is important, and we encourage you to think about how you can take the information that you've learned here and move that forward. And again, I encourage you to utilize the videos that we've showcased throughout this month in your classrooms and your training sessions and your caregiver support groups, sharing on social media, however you see fit to help get the word out, so that those experiences help encourage people to think about what it's like to live with dementia, and more importantly, to ask folks that they know for their lived experience. Again, thank you to the Department of Human Services for their funding and their assistance with this project. I hope you've enjoyed this webinar series. You will receive an email asking you to complete a short evaluation because your feedback is very important to us as we engage in future educational events. And thank you for joining me. Feel free to email me if you have questions moving forward, if you decide that you do want a hard copy of those items. My email is administrator@georgiagerontologysociety.org. And thank you. Have a wonderful day.